Okay, so we're going to continue our discussion of microbial diseases, and we're going to begin now our viral discussion. So let's talk about viral infections. Now, just like with bacteria, viruses are going to be able to impact or infect any area of the body. When we're going through the 6 different diseases, they're all picked because they have unique features to them and their virulence factors, either the cell type for which it invades or how it alters the normal cell functions or metabolic properties. And it may even be the fact of how that host's defense mechanisms work. So really pay attention. These 6 are picked because they show how unique viruses can be when infecting and impacting a human host. So we're going to start with one of the most common ones, and that is influenza. Now, the flu virus is the one that is going to be a respiratory virus. It's significant in the fact that it can impact 20% or more of a population each year. Flu season, as you know, runs from the fall to the January, February for us here in the United States. So let's talk a little bit about that causative agent. So the influenza is going to be caused by a virus that falls within the Orthomyxoviridae family. There are 3 different types of it, A, B, and C. A and B are the ones that we associate with that yearly epidemic flu season that goes out there. Type C is out there, but it's going to have much more mild symptoms. It's going to be less severe. Now, you need to understand a little bit about the structure of the flu virus. So we've got it over here. As you can see, it is going to be an envelope virus. That's what this green teal color is. It does have spikes on it that we're going to talk about here in a minute, but it is an RNA virus, a single-stranded RNA virus. Now, when we talk about the flu, as you know, flu is going to be transmitted from airborne droplets. Because it's a respiratory virus, we're going to get it because we've breathed in the air and gotten those droplets from somebody else who's already infected. Once it gets into your nasal passage, into your oral passages, it's going to bind to that ciliated epithelium along the nose, the throat, and if it gets severe enough or further enough in the infection, it could even get into the lung region. Once that virus attaches to that epithelial tissue and gets inside the cells, remember it's an intracellular parasite, so it's going to get inside the cells and it's going to start to destroy that epithelial tissue. Once we start doing that tissue damage, then that's when that inflammation process, because the host is trying to defend itself. So the types of symptoms we're going to get are going to depend on where exactly it's impacted and how far it gets in that cellular destruction. Now, one of the things that's going to lead to its virulence factor is the fact that the flu is unique in the fact that it has an adaptive immune process for which it can change the way it looks. So, think about how antigens work in that host immune response. An antigen, foreign substance, comes into the body. The body is going to recognize that it's foreign. It's going to mount an immune response. And remember how that immune response goes. It sends some of the cells out to fight the infection immediately, and then some of them stay behind and do for memory cells. Now, if this is our flu virus, as we said, and it's got an enveloped virus, and embedded within that envelope are these spikes, what would happen if you could change the way that whole outer envelope spiked looked? Then the body wouldn't recognize it. So, and that's exactly what happens with the flu. Each and every year, it changes that antigenic determinant factor here, which means its outer shell. And so the body sees it as something different. So the memory cells and things that are built up in order to help us mount a faster immune response each year, it's not there. So that allows it to be virulent, and that's why it has such an impact. Now, how is it able to change that outside look? It's able to do it because it of something known as antigenic shift and antigenic drift. So going back and thinking about that structure of the flu virus that you just saw, and you saw that they had those spikes, those little pink and orange spikes. Well, those represent the 2 spikes, hemagglutinin and neuraminidase. Now, hemagglutinin is the going to be the spike that helps that flu virus attach to the host cells and get the cell or get the virus inside the cell. So the H spike gets the virus inside. The neuraminidase, the N spike, is what's going to help get that virus out of the host cell and allow it to spread. So we have the H and the N's as those spikes. And you've probably remember a few years back we had a major flu virus and it's referred to as an H1N1 because it was talking about variant 1 of the H and variant 1 of the neuraminidase. Why? Because there are, if you look down here, if I skip to the last bullet, there's 16 variations of H and 9 variations of N. If you take up all the combinations, you'll have 144 possible combinations. So it can keep changing and changing and changing, and you're going to each year have a different combination. So how does that happen? Again, because of antigenic drift and antigenic shift. And what does that mean? So in antigenic drift, it's changing its antigenic properties because of mutations that occur. And that flu virus is easy to mutate. It can do it in antigenic drift through spontaneous mutation, meaning once it gets inside the host cell and it takes over the host cell's mechanisms and it's replicating itself, because of its normal ability to mutate, it's going to have a large number of spontaneous mutations. An antigenic shift, the virus is going to get into the host cell, another virus is going to get into the host cell, and the host cell is going to end up pulling pieces from part A virus and part B virus and creating a new virus. So let's look at those just a little bit more and recognize there is a great one-page display in your textbook for both antigenic drift and antigenic shift to help you understand those terms. But in antigenic drift, again, the virus gets inside the host cell. It's got its protein spikes on the surface. It takes over the host cell. It undergoes replication. And in that replication process, because of its ability to mutate so quickly, it has taken one of those surface proteins and mutated it. So now it looks like it's got a whole different antigen on its surface, so it makes it harder for the host cell to recognize. And again, in antigenic shift, you have two different viruses, virus A and virus B. They're coming into the same host cell, and generally it's a pig, to be quite honest, that initiates it. Then the pig is going to take one protein from A, one protein from B, create another virus, which is now called virus C, that's got a combination of these two. And so now when we come in contact with this virus, it looks again whole different scenario, and so we're having to treat it like it's the first time we've seen them. So again, the two viruses look different, and that's what gives it the virulence factor. So we've all had the flu, hopefully not, but I'm sure everybody's had it, so you're aware of those symptoms of chills and fevers and sweats and headaches and pains. And again, if it gets down into the lungs, as we said, if it progresses, then it may even lead to pneumonia and the symptoms associated with it. So how do we treat it? Well, the flu is a virus, so we generally let it run its course, good amount of sleep, chicken soup, etc. But we can also take Relenza or Tamiflu to try to help prevent its spread and get it before it gets too severe of infection. And then we also have the flu vaccinations. Now, the flu vaccinations, again, you recognize that some years they work great and some years maybe not so much. Why? Because think about what we have to do. If each and every year the flu is changing its antigens, changing the way it looks, then what we're having to do with this flu vaccination is try to figure out of those 144 possibilities using stats and looking at what has happened over the past few years for the way that the flu is mutating. We kind of have to make an educated guess on what are going to be the most common combinations, and that what gets put into that flu vaccination. Generally, science can hit it, but some years they do miss because it goes outside of what they think it should. So again, the vaccinations are recommended because it has a good possibility of preventing the spread, but it doesn't always work 100%. So just keep that in mind and why that's the scenario. So that's the flu. Okay, so now let's start talking about the chickenpox. Chickenpox is also a very common childhood disease. It is becoming less and less common because of a vaccine that was released in the early 1990s. But chickenpox, when it's in its virulent state, is known as varicella. So you should recognize both terms there. It's highly infectious disease. It is caused by what is known as the varicella zoster virus, or the VZV, and that is going to be a member of the herpes virus family. As mentioned, when it's during its infectious stage, it is referred to as the varicella virus. And once it gets into the human body and we start talking about the pathogenicity, you're going to see that it can go in and go from the respiratory system into the blood, and then it gets into the nervous system, and it's going to sit there and it can go into a latent phase. And if it reemerges, it will reemerge as the herpes zoster virus, which causes shingles. One thing to recognize, even though somebody is able to transmit or contract the chickenpox through touching of the blisters that may have ruptured and things like that, it is actually considered a respiratory virus because it's spread more easily and more often during that asymptomatic phase when somebody has the virus and is unaware of it, and it's replicating and dividing, and they're going to transmit it through the respiratory droplets. So that tends to be the more common way, even though contact does occur as well. Now, when we talk about virulence factors, the varicella zoster virus is able to, when it gets in, it's going to, and gets inside the host cells, it's going to lead to cell death because it starts to shut down the various cellular processes. In addition, what you have to recognize is that this virus is going to ultimately move into the nervous system, and it's going to go into the ganglia, and there it's going to rest, become dormant, latent, if you will. And then for some, it will never reactivate, and then others, it's going to reactivate as shingles. So let's talk about those steps in pathogenicity. So the virus is going to enter in through the respiratory tract. That's the more common, even though we did say it can be contact as well. It's going to come in through the nasal passages. It's going to attach to that mucous membrane. It's going to replicate in there. It's going to ultimately move from the mucous membrane into the bloodstream, into the lymph. It's going to end up making its way into the rest of the system. So it becomes systematic, basically, between the liver, spleens, and lymph nodes. And there it's going to take it, and it's going to take it a couple weeks to get through all of these steps. So as it's moving through, it's going to be asymptomatic, but people are still going to have the virus inside replicating. So they're actually, in this 2 weeks, they're transmitting it through the respiratory droplets. But as the virus makes its way through, ultimately, think about, where do you see it? You see those blisters and those poxes on the skin. So it comes in, it goes deep, and then it moves its way back out to the skin, where it makes and creates those lesions that we're used to seeing with the chickenpox. So those vesicles move, they cause pustules and a rash that ruptures, and eventually it will crust over into the scabs, and somebody will be able to clear it out of their system. So this is a typical look of the chickenpox here. And one thing to recognize with the infection is, because it's a respiratory infection and it comes in and it can take a couple of weeks. So it comes in, gets deep, and then it moves back out to the skin. But the areas for which it infects, so the first area you'll usually see those blisters or those poxes are going to be on the core, so on the abdomen and on the back. Then it will tend to move up to the neck and the face, and then to the extremities. So the pathway for which it spreads is also directly related to that pathway for that nervous system. Notice too that the symptoms, they're going to be headaches, it might be fevers, it might be just overall feeling bad. Of course, you're going to get the blisters and the poxes, etc. In treatment, you're going to treat the symptoms to try to make the child as comfortable as possible. Now, I keep saying child, but do recognize that the chickenpox, even though it's considered more of a childhood disease, it can affect teenagers and adults if they've never had the disease as well. If for some reason somebody is developing a lot of the blisters on their face, near their eyes, or getting them on the inside of their mouth, etc., then a physician may prescribe an antiviral drug to try to prevent it spreading as fast. But for the most part, there's not a drug that's going to be specific for the chickenpox. Now, again, there is a vaccine that became available in the 1990s, and it has helped reduce the actual spread of the active virus. Now, we have mentioned on a couple of times already that the virus, it gets in through the respiratory tract, it moves, it gets deeper, and then it's going to go out to the skin. But one of the things you have to recognize too that was mentioned is that varicella virus gets into the nervous system, and then it gets in and it holds into the ganglia, and then it will stay there in a dormant state. However, and again, so it stays, and you need to recognize the dorsal root ganglia, and it can stay there for some and never reactivates. But in about 30% of the patients, then that virus will reactivate. It moves along the base of the trunk, so that most likely you'll see that when it comes back out of that peripheral nervous system, it's going to cause blistering, and because it's coming out through the nervous system, the nervous tissue, it's causing severe pain that they say is like an ice pick pains. And so again, all we can do on this is do treatment of the symptoms and try hard to put the person and make them as most comfortable as they can, because shingles can be quite painful. And generally you see it around the belt or the waist, but sometimes you'll also see it up on the shoulder and neck regions as well. But shingles is a reactivation of the varicella zoster virus, and so it's in the herpes zoster virus is what is known as shingles. Okay, so let's now talk a little bit about hepatitis. And by hepatitis, we mean that it's going to be an infection of the liver, so it's causing that inflammatory response. There are many kinds of hepatitis. We're limiting our discussions to hepatitis A, B, and C. I'm starting with hepatitis B because it's going to have the most major impact, because it infects more than 1 billion people worldwide, with over 2 million of them being chronically infected. When we talk about hepatitis B, it is going to be caused by a DNA virus, and that DNA virus is going to belong to the Hepataviridae family. When we talk about the DNA virus here, when you look at the DNA and then you got its capsule here, notice there's this third layer, so that means it's going to have an envelope, and then within that envelope it's going to have embedded these surface antigens. One of the things about Hep V is that its transmission is generally going to be through direct contact with infected blood. So that may come through breaks in skins or mucus and somebody coming in contact with that, such as a healthcare worker. It may be through injection, or it might even be through sexual contact. And then once a person gets infected, that virus may go into periods of latency before it becomes active. But once the virus enters and it comes into the body, it's going to go to the liver and it's going to get it in the hepatocytes. And then once it gets into the hepatocytes, it will start its process of taking over the host cells, replicating, and then in order to be transmitted, it's got to be released from those host cells. Now, just a word to remind us about what we studied a couple of units ago. Remember what happens with the virus. Once it gets inside the host cells, takes over, replicates, gets rebuilt, and now it's time to release, it can release in two ways. One way is it can just cause the cell to lyse and release lots of viruses at one time, but that's not the case with Hep B. Hep B actually uses that exocytosis process where it doesn't destroy the host cell. So the host cell keeps making the viruses and releasing them, but it releases them, that continual release, slow amounts over time. So when somebody has Hep B, it can lead to either acute or chronic symptoms, and part of that's going to be dependent on, is it latent or not, and it's using to its advantage that exocytosis method for release. So if somebody has acute Hep B, the virus is going to be short-lived. Those symptoms are going to generally occur within those first 5-6 months. It's going to be those typical, somebody doesn't feel well and that you're going to have malaise and fevers and things along those lines. But the telltale sign that'll occur several months in is going to be the jaundice. And remember, people who have hepatitis, that jaundice is that yellowing color that shows of the skin and of the eyes. But after those people go through an acute, they are usually able to self-recover and they do develop an immunity to it. However, in some cases, because of the latency, because of the way the body reacts, for some people, unfortunately, the virus continues to persist, and those people will develop what is known as chronic Hep B. And in those cases, because the virus continues to persist in its replication and doing damage, it can lead to cirrhosis of the liver. And if it leads to cirrhosis of the liver, it can become significant enough of a disease that somebody may have to get a liver transplant. How do we treat Hep B? Well, a lot of it you're going to treat is the symptoms themselves, but there are vaccines for Hep B and various drugs that can be available as well. One of the things that is used frequently for Hep B is what is known as interferon, and so the interferon treatments are the cytokines that too helps prevent the spread and the damage done by Hep B. Now, let's talk a little bit about Hep C. Hep C is going to be an RNA virus, unlike Hep B, which was a DNA virus. It belongs to the Flavidoviiridae family, and it is going to also be transmitted through bodily fluids, but how that's going to be transmitted, generally speaking, is through needle contamination rather than or less likely than sexual contact. And so the needles, it's because it's seen with tattooing, with body piercing, with unfortunately healthcare workers who might come in contact with a contaminated needle. In the case of Hep C is a very slow to progress virus. So once it gets in to the bloodstream because of that contaminated needle, it can take years sometimes for somebody to even know the symptoms. Now, why is that so important? Is because think about it, it's going to the hepatocytes and it's doing slow damage to the liver. And as that liver is slowly becoming more and more damaged, and it's taking a long period of time, so it's a chronic infection and a chronic illness until that liver becomes so damaged that jaundice is beginning to set in and some of the significant symptoms, somebody may not notice it. They may just think if there are any other signs that are more mild along the way, they may think it's another disease, etc., and they'll recover and come back and forth. So in the case of Hep C, it's actually considered to be a silent killer, a silent epidemic, because of how long it takes from the time of infection for the time of symptom to show up. And if people are inactive or not being proactive to get rid of the disease, by the time they are noticing it, there's so much so much damage has been done to their liver that it's almost going to always require a transplant. And so that makes it a significant factor in in how we're treating it. Okay, so now we're going to the last of the hepatitis that we're going to look at, and we're looking at now hepatitis A. Hepatitis A is very, very different from B and C. For one thing, it's transmitted from what we say the oral fecal route. Why? Because hepatitis A is more of an infectious hepatitis. So hepatitis A belongs to the Microbial family. It's a single-stranded RNA virus, and it's a naked virus, so it doesn't have that envelope around it. And what's going to happen in Hep A is that somebody is going to ingest contaminated food or water that has Hep A on it. They're going to ingest that, and so since it's coming in through the oral cavity, it's going to go down and it's going to get into your GI tract, and as that virus moves through that epithelium, either in that esophageal region or the small intestine region, it's going to attach to the mucous membranes, it's going to enter into the bloodstream, it's going to end up going from the blood to the liver, where it then enters into those liver cells, the hepatocytes. Ultimately, it's going to get into the Kupffer cells and infect the bile. Okay, and then once it gets in the bile, then it's going to be excreted through that normal processes, and it's going to be found in the feces. And so if people don't handle food properly, if they don't wash their hands properly after using the bathroom, somebody who's got Hep A can get contamination, or in third world countries where sanitation's just not the same, so that you get the feces gets into the same area, food preps, etc., the food, the water, and somebody ingests it. So this is how the pathogenicity for Hep A. So it is an inflammatory liver disease, so it is going to cause some of those same symptoms that we saw before, in particular jaundice occurring. The best way to treat this one again is to look at how we are doing our prevent transmission through hand washing and food prep areas, and just being a little bit more with our personal safety features as far as that goes. There's really no major treatment. We just kind of have to treat the symptoms, and a lot of times people are not even aware so much that they have this unless it gets to be highly infectious, and then that jaundice and everything else is setting in. So just a quick chart kind of on A, B, and C, recognizing that A is usually asymptomatic or mild, so people don't always recognize it. You are going to get that when transmitted through contaminated food or water. There's really not, you just kind of treat the symptoms if you happen to notice them, but there is a vaccine for Hep A. Hep B, it is going to be generally more acute, even though at times it can go to chronic. If it goes to chronic, it can lead to cirrhosis, which means the biggest treatment would be the fact you may have to have a liver transplant. But generally speaking, it's not going to be chronic. It is going to be acute. We're going to treat it with certain drugs and interferon. It is going to be transmitted through contact with bodily fluid. It can be from open wounds, sexual contact, etc. There is a vaccine available for Hep B. Hep C, it is chronic. So whereas the other two were generally more acute, this one is going to be chronic in 75% more of the cases. It does generally, because it is chronic, it does generally lead to complete liver failure and cirrhosis, which means that part of the treatment is going to be a transplant. How do you get it? Coming in contact with, generally speaking, it's infected needles, even though to a lesser degree sexual transmission can occur, and there is no vaccine for Hep C. So with the hepatitis, make sure you can distinguish between the three for their unique factors between transmission. Is it acute or is it chronic? Treatments and our vaccinations. So that's going to conclude the first of our videos on viral infections.